Hi, everyone. This is Dr. Bob. I'm Dr. Bob Gabay. I'm the Chief Scientific and Medical Officer for the American Diabetes Association, and it's my pleasure to host Ask Dr. Bob. And this is where you put in your questions in the chat box below, and I can answer those questions for you. A number of people have already sent in questions from our last session in preparation for today. So I'm just going to get right started and go for it. So let me pull up the questions. So here's one around type 1 diabetes. So the question that came in is, what's the connection between type 1 diabetes and hypothyroidism? And I'll just remind people, hypothyroidism is a low thyroid level. And the questioner says, since they're both autoimmune, which is true, could there be an underlying issue that could contribute to someone having both? Could this underlying cause lead to other bodily symptoms being attacked as well? And so it's a great question. There is definitely a connection, and the questioner is absolutely right. They're autoimmune diseases. So remember that type 1 diabetes is an autoimmune disease where the cells of the pancreas that make insulin are destroyed. And it turns out that people that have one autoimmune disease are just more likely to have other autoimmune diseases. And so that's true for people with type 1 diabetes. One of the most common autoimmune diseases they can develop is hypothyroidism. And what happens there again is that the body's immune system attacks the cells of the thyroid, a gland in the neck that produces thyroid hormone, and it destroys the ability to make thyroid hormone, and so their levels are low, and that's treated by taking thyroid hormone tablets. So, as I said, people can have other autoimmune diseases, and I'll just mention a couple of the common ones to think about. Celiac disease, which is people that are intolerant of gluten. That is more common in people with type 1 diabetes. And in some individuals, we will in fact screen for that. For thyroid disease, for many people with type 1, we would screen yearly with a blood test to see if they're developing hypothyroidism before it happens. So celiac disease is one. Another is autoimmune destruction of the cells that make the hormone cortisol in the adrenal gland, and that's called Addison's disease. And so people with type 1 diabetes, more risk for Addison's disease. They may notice that they have Addison's disease by having nausea, vomiting, fatigue, low blood pressure. All of those things can go with Addison's disease. Or they're all of a sudden noticing that they're more likely to have low blood sugars. And then the last one that I'll say is somewhat common in people with type 1 diabetes, autoimmune disease, something called pernicious anemia. And that's where the cells of the stomach that help to process and absorb vitamin B12 are destroyed. And so people become anemic because they don't have enough of that. They're not absorbing enough of their B12. So hopefully that answered your question, and I'm going to move on to the next one about type 1 diabetes. And of course, we'll move to type 2 in a moment. So for all of you with type 2, stay tuned. So this says, this person says, no one in my family has diabetes, and I have 2 daughters with type 1 diabetes. Since it doesn't run in my family, is this consistent? Is there some genetics here? Well, yeah, so that's a great question. So type 1 diabetes has some genetic risk associated with it. We typically say it's about half of the risk of developing type 1 is genetic, and the other half is something else, and we're not sure, some environmental trigger. For someone that has type 1 diabetes, the chance of their first degree relative having type 1 is about 5%. So if someone has type 1, their child has a 5% chance of having type 1, which means a 95% chance of not having type 1. So yes, there is some genetics at play here. Someone asks, when could I take insulin along with metformin? Well, let me shift to talk, metformin is a drug we typically use in people with type 2 diabetes. And what metformin does is make the body more sensitive to the insulin that one makes. And that's why it's typically used in people with type 2 diabetes that produce some insulin. People with type 2 diabetes can lose their ability to make insulin over time. And over time, it might get to the point where they need to take insulin. Metformin can still be used in those cases for a couple of purposes. One, to not need quite as much insulin, not need to take quite as much insulin because it makes you more sensitive to insulin. And two, it helps with weight. And since many people with type 2 diabetes are overweight or obese, it makes sense to use metformin in that combination. All right, we're moving right along. This is a great question, I think very timely. And it sort of goes with a series of questions that relate to the big health issue that we're all facing, and that's COVID. So here, this person says, Dr. Bob, it's been a tough year, especially for those of us living with diabetes. Can you make a recommendation for how to best manage our emotional and mental health while we work every day to stay physically healthy? Thank you. Well, I really appreciate you bringing up that question. I think it's critically important. It's such it's been so challenging for us to be physically isolated. Let me remind you, and I used physically isolated as really the key. It's not so much about, we don't want to be isolated emotionally. And so some of the tactics that we can use to help deal with the emotional and mental health challenges, first of all, if these are significant, you should speak to a healthcare provider that can help you. And there are many of them, and they do virtual visits, so you can do that from the comfort of your home safely. But some helpful tips. Connect with other people, with your friends and loved ones. Stay connected. That social support is really important. Think about things that you can be grateful for. Gratitude is really an effective way for us to maintain our mental health. And again, seek help when you need it. And finally, the American Diabetes Association has a number of resources to help coping with diabetes and also around COVID. And I encourage you to go to our website at diabetes.org where you can get more information. And we also have a list of mental health professionals that have special expertise around diabetes that you may be able to use to identify someone if you need further care. All right, let's move along. In the theme of COVID, were people with type 1 diabetes included in the COVID-19 vaccine trials? I've not seen any information on this. I don't think we know that specifically, but it was a large number of people, and so I can't tell you that. But this sets up maybe the second question that came from someone else, which I think is really timely, is what are your thoughts and recommendations regarding the COVID-19 vaccine and someone with diabetes? I would say simply get the vaccine. People with diabetes are at higher risk for doing poorly with COVID. In fact, if you look at all the people with that have died from COVID in the United States, 40% of them have diabetes. So we need to do something about that, and that's where getting the vaccine can be really helpful. And remember, the vaccines have gone through testing with tens of thousands of people. It have been studied, and the FDA has approved it. And again, only FDA-approved vaccines are the things that you should be thinking about. But we certainly recommend, and the American Diabetes Association has been advocating to ensure that people with diabetes are high priority to get the vaccine because of the risks that COVID posed to them. The next question is, what are some tips for managing diabetes during the holiday season? Yeah, this is always a challenging time for everyone. You know, there's lots of food around. We may not be as active. This year is a really unusual year. Number one, think about COVID and stay safe. Physical distancing, washing your hands, wearing a mask, those are just the baseline. You know, I tend not to say don't eat any of this and don't eat any of that. Eat a little bit, right? You can try the some of your favorite foods and have portion control. Have a little bit. You're going to have a wonderful meal. Do that, but maybe don't go for seconds. It's all about portion control. And where you can, add some physical activity in, because that's a great counterbalance to some of the food that we're all likely to be consuming over the holidays. The next question is, what are some signs that I might have diabetes? Well, that's a good question. What are some of the signs? Well, first I'll say that most people diagnosed with diabetes have no signs, no symptoms of diabetes. And that's why a quarter of the people with diabetes don't even know they have it. So it's important to be screened regularly and talk to your healthcare provider about being screened for diabetes. But the classic symptoms of diabetes are excessive thirst, excessive urination, can have fungal infections. Women can have vaginal infections. These are signs of the possibility of having diabetes, and blurry vision. Those are the things to watch out for. And again, being screened with a simple blood test. And the other thing I will tell you is that at the American Diabetes Association website, we have a risk test. It's a quick, takes less than a minute to do. You answer a bunch of questions and it'll tell you what your actual risk is. And that can be really helpful. Okay, so here is another question. Should people with diabetes advocate to see an endocrinologist versus speaking only with their primary care provider? Well, that's a tricky one. So first, full disclosure, I'm an endocrinologist. But I don't think I'm biased in this answer, and hear me out. I think the decision is really how things are going. So if you're doing well, and your diabetes is well managed, and you've got a good rapport with your primary care doctor, I think that's great, and you probably just stick with them. There's no problem there. Primary care doctors take care of 90% of the people with diabetes. So simple odds, most everybody is going to be managing their diabetes through their primary care doctor. The endocrinologists are probably best for people that have more complicated disease, have complications of their diabetes, or struggling to manage their blood sugars and not doing well. They're sort of the specialists that can help when you're not doing well. And so that might be the easiest way to think about it. If you're doing well, stick with your primary care doctor. If you're not, then see about seeing an endocrinologist. The other thing that people sometimes do, and I've had patients come to me for this purpose, is to come and just get things checked and see where they're at. Are they missing anything? And that may be just a one-time visit. But you know who is often left out of the healthcare team that really should be thought about, even more so in many cases than the endocrinologists? Those are what we call diabetes educators, or what are now renamed diabetes care and education specialists. So these individuals can help no matter who you are with diabetes. They provide you with really valuable information. And I think they are the ones that you should be thinking about. Oh no, my mouse is dying. Uh-oh. Okay, sorry about that. We'll move on. I think we are running out of time, and so I am going to end with that. And thank you, everyone, and have a happy and healthy holiday. And look forward to seeing you all next year. Enjoy the holidays. Be well and be safe.